right, we are officially on. I want to give a good afternoon to everyone. Happy Thursday to you all, or as I like to call it, happy pre-Friday for those of you who live for the weekend. This is LaShanna of LaShanna Leonard Inc., Health, Wealth, and the Abundant Life. I want to thank each of you for coming on and for signing on and for attending the virtual summit all week, Infertility Awareness Week. Hashtag flip the script. Together we can flip the script. And it has just been a wonderful week of sharing hope, help, and information to women and men. Thank you guys actually for joining in, all of the she warriors and the gentlemen as well that have been signing in. Because this journey is a partnership, it is so great to see the amount of support that we've received from our gentlemen. But we've been sharing information all of this week as it relates to fertility, fertility health, reproductive health, and sharing on last night success stories from women who survived infertility. And so there was no other option, you guys, to close out this virtual summit but with one person. And I am so glad that she was available. Listen, she's not lacking for any downtime. It's not like she doesn't have anything to do. She's got a lot on her hands. And so I'm so grateful that she was willing to join us today in our virtual summit wrap up. I'm going to introduce her in just a moment, but I do have to give my special thank yous. I do want to give a special thank you to my business, LaShanna Leonard Inc., to Fertile Girl Organization for all of the work that they have been doing during Infertility Awareness Week. Also for the Office on Women's Health from the U.S. Department of Health and Human Services. And then I have some other special thanks that I'm going to save to the end of today's broadcast. Remember, you all, it is very interactive, so you have the freedom to ask questions once we complete the dialogue and the presentation. You're going to have an opportunity to ask questions. So have your questions prepped and we're going to move forward. I'm going to share with you a wonderful bio of this awesome woman that you're going to experience today. Dr. Lina Akopians is a passionate physician driven by her love for medicine, volunteer work, and patient services. She successfully finished her accelerated 2-year reproductive endocrinology and infertility fellowship program at University of California, UCLA. She has conducted research on polycystic ovary syndrome, PCOS, and egg freezing. Dr. Akopians is interested in the future of reproductive services, family planning, and the understanding of the endocrine system. Additionally, she is committed to her education and is eager to pass on her devoting to learning as a professor at UCLA Extension, in addition to helping patients become parents at the Southern California Reproductive Center. Dr. Akopians received her bachelor's and master's in physiological science, as well as her PhD in molecular, cellular, and integrative physiology from UCLA. So you guys are in for such a treat today. She subsequently completed her medical training at Albany Medical College in New York, then returned to Los Angeles for her OB-GYN residency program at UCLA, then completed her REI fellowship training at the UCLA and Cedars-Sinai program. In addition to a multitude of scholarships, Dr. Akopians is further recognized by receiving special honors and awards, including magna cum laude from UCLA for her undergraduate studies, the Alpha Omega Alpha recognition for her medical education, the Arthur Hingerer MD Award for excellence in gynecological surgery at Albany Medical College, and the Special Resident in Minimal Invasive Gynecological Surgery Award at UCLA and the OB-GYN Residence Program. Furthermore, Dr. Akopians has authored and co-authored numerous publications covering a range of reproductive and prenatal related topics. Fluent in Armenian, Farsi, and English, Dr. Akopians is dedicated to continuously improving her well-crafted skills to provide the best service to her clients, Are you ready to meet this wonderful physician? Well, without any further ado, I would love to introduce to you all Dr. Lina Akopians. Dr. Akopians, thank you so very much for joining us today.
Thank you so much for the time.
Absolutely. And so as we dive off into this, I want to do first things first, and that is basically to define what a fertility specialist is. If you will share with us in the essence of the term, what is a fertility specialist?
Absolutely. So as is, we have additional training aside from the OBGYN residency in the fellowship program that we specialized in really trying to help women who have difficulty getting pregnant. So we deal with the endocrine system that deals with ovarian function, and we're able to, with our testing, find out what could be the cause of some patients having difficulty getting pregnant.
Excellent. So ladies, She Warriors, this is all about you. This is for you. We're going to listen in also. We're going to dialogue with some questions, and Dr. Akopians is going to answer. A lot of these are very common, frequently asked questions, but also sometimes we don't really know where to start. We don't really know what questions to ask, what kind of testing is essential. And so we're going to cover quite a few questions within the scope of time that we have available. The first question, Dr. Akopians, I would like to ask you is, how does age affect a woman's ability to have children?
So age, unfortunately, in terms of fertility, most fertile females are women in their 20s. So mid-20s is the most fertile time. And as we approach our 30s, fertility starts to decline, and it's more drastically so after age 35. So we know that our eggs were always there when we were first born. So we have the maximum amount of number of eggs we'll have when we first take a first breath, as I always mention to my patients. And we go on life, and after puberty, we start declining in the number of eggs that we have. And all the way to when we reach menopause, we're down to having approximately 1,000 to 2,000 eggs left over. So it's very critical. And as these eggs sort of be in our bodies since we're born, their quality deteriorates as we get older. And that's why it becomes harder for women to get pregnant after age of 35.
Wow. Age of 35. So what would your suggestion be for women who are career driven? They may not have found the partner that they are ready to have children with, or maybe not even clear on whether they want to be a mother yet. What would your recommendation be for those ladies?
So one way you can fertility is by doing egg freezing at a younger age. So if you're in your early 30s and you are career driven and you're not yet ready to become a parent, the one option that we have is actually doing fertility preservation, where we take them out in one cycle in 1 month, and we freeze them to be used in the future.
That's excellent. And I would like to add to that, Dr. Akopians, that where Dr. Akopians works as a physician, the Southern California Reproductive Center has such a wonderful portfolio. They have the state-of-the-art facility. It is beautiful. And they have the highest success rate, if I'm not mistaken, double the average success rate. So the other great thing about it is that if this is an area that you are most likely a candidate of, their scope of practice does not just restrict itself to patients in California. They have patients all over the world that they work with. So I'll be sharing with you that information at the very end. But this is definitely, ladies, if you're not sure, you're career driven, as Dr. Akopians has mentioned, you really want to start looking into a more aggressive way of freezing your eggs as an option. How long should women try to get pregnant before calling their doctor?
The recommendation has to do with age. So we always say you're under age of 35, after 1 year of trying it and they have not been successful, it's time to see a specialist. Women who are above age of 35, because the deterioration of egg quality happens in a faster pace, we would like to have patients see us with 6 months or less of trying.
6 months or less of trying. Wow. Okay, and so how will doctors find out if a woman and her partner have fertility problems?
So when patients have history and a physical examination, we try to individualize the treatment plans and the care we have for our patients. So we generally start off with doing ovarian reserve testing for the female.
Okay.
To see how many eggs or follicles that they have, and is that appropriate for their age. There is a testing known as anti-Mullerian hormone that it checks ovarian reserve testing. We recommend doing that, as well as doing testing of their hormones that their body naturally produces on the 3rd day of their menses to make sure that the physiology within the way the ovary functions is normal. We then also check the uterine cavity, making sure that there is no polyps or fibroids in the uterus that may impact fertility. And then we also check the tubes. We want to make sure the tubes are open with a study known as HSG. And our workup will not be complete unless we also test the male partner, because approximately 20 to 30% of infertility is related to the male partner. So we start off semen analysis on the males to make sure that we have appropriate amount of volume of semen, that the shape of the sperm looks good, the concentration of the sperm being normal, and the percentages that is moving in terms of the sperms are normal. And then based on what we find, then we individualize the care we provide for the patients.
Wow. So there's a series of testings and procedures that are into place to determine the type of treatment that's recommended. What would you say is the most common issue that you may find in testing to determine infertility or fertility challenge?
So approximately 30% of infertility is related to something related to females. So if the female is of a younger age, it's likely related to ovulation and every month, such as we mentioned before, the PCOS. For example, our PCOS women have tons of eggs, but they just don't release it because the signals are not there in the right way to help release those eggs. So we find it that in younger women, it's probably ovulatory dysfunction. And with women, it's likely related to the age effect that we discussed earlier in terms of the quality of the eggs that they have. In young women, we can also have male factor issues, because 30% of infertility is related to males as well. So sometimes they have no sperm, or they have very poor quality sperm.
Right. Wow. Now, what do you qualify as when you say the term young woman?
Probably the most fertile ones, that by definition in their 20s.
Or in their 20s. Yeah. Wow.
Fertility.
Well,
I think everybody is young, right?
Yes. But we're at least young at heart. Absolutely, absolutely. So in your 20s is really the prime time. And I know, for most of us in our 20s, we're not really thinking about, I can remember years ago. In our 20s, we're not really thinking about the process. You're born, you're a female, and it's a natural part of womanhood. And you really don't think through, well, I may need to be proactive about my future as it relates to reproduction. But if you are watching and you're definitely in that prime of your 20s, you want to give yourself as many options and freedom of options as you can. And that's really the time frame to do that.
Infertility affects one in So, bringing it's a very important week, and then we try to give the message and educate our patients regarding how common it is.
Yeah. And then here is the thing also, everyone, it's not anything. Being challenged with infertility is not something to be ashamed of. One of the things that we're definitely seeing is how women in Hollywood are starting to step up and speak out about their challenges with infertility. It's not a discriminatory situation. It's not based on socioeconomical status at all. It affects so many women from all walks of life. So it's definitely something that you shouldn't feel ashamed of. I know many of you have had very detrimental and painful experiences in the scope of fertility and being challenged. But know that you're not alone. If you heard what Dr. Akopians just said, just the percentage of how many women are affected by infertility. So, Dr. Akopians, how do doctors treat infertility?
So treatment options, what we find during the testing part. For example, if somebody doesn't have tubes that are open or their tubes are blocked, that automatically engages us in a treatment option with IVF, where we bypass the tubes in order to get somebody pregnant. If it's an ovulatory dysfunction and somebody's just not ovulating, then the options would be to do medications that you just take as pills that for 5 days in order to help induce that ovulation. But generally, if I were to say, it's either pills and sort of combining that with what's called intrauterine insemination, IUI, where we take the male semen, we wash it and concentrate it in a very small amount and place it inside the uterus. It's either options of treatment with medication and IUI combined, or IVF. It's the second option.
Wow. And do you usually find that there is more of a resistance or hesitation with the men as it relates to undergoing the process? A lot of men are under the assumption that they're going to walk with their female partner alongside of them through the journey, but it's a direct involvement with the men as well.
Yeah, there is, but that I've had, they come into the consultation with their partner, and it's really a journey that they're going to be undertaking together. They've been very
yes. Yeah. Definitely true. Fellas, we need you alongside of us, but we need you involved as well. All right. So what medicines are used to treat infertility in women? I love that we are in such an age of technology and medicine and advancement that it's opening us up to more options and more treatments that can be considered for the women.
The medication that helps us in making women ovulate if they don't typically ovulate on their own, or we make women super ovulate if they do ovulate already, but we can give the Clomid to sort of boost their ovulation. We also have a medication known as letrozole, which works similar to how Clomid does. It's a pill that you also take for 5 days. So those are for induction of ovulation or super ovulation for intrauterine insemination cycles. We also have injection medications, the same injection medications that are used in IVF. It would be F.A.C.O.G, also known as follistimol gonolef, and the other one would be Menopur, which is HMG. And those are given in combination as injections to be able to get the follicles in the ovary to grow over a 10 to 12 day period.
Wow. So what would be the time span that and I know it's not a generalized situation because each couple and their scenarios are extremely different, but if a couple were planning to go through fertility treatment, what would you say the scope of time would be that they could expect to be involved through this process?
So it really depends on what. If their treatment chooses to do medication with insemination, generally 4 cycles to 6 cycles, which means about a 4 to 6 month trial of the treatments we'll discuss and offer. Research has shown to continue doing cycles with Clomid and intrauterine insemination really beyond 6 cycles probably will not be giving us the goal and helping us get to the pregnancy. In terms of IVF treatment, the treatment in order to get the eggs retrieved and create the embryos is approximately a 3 to 4 week time period. The injection medications are generally about 10 to 12 days.
10 to 12 days. Got it. Wonderful. And so we're already talking about treatment, and you've actually already touched on this when you were talking about the different scopes of IUI. Would you explain what the intrauterine insemination is again? This directly involves our men.
Absolutely. So in the cycle that we're doing intrauterine insemination, when the follicle or the egg is ready, and we want to time that perfectly with when we're going to be doing the insemination, the male will come into our office and give us a sample of ejaculate, where we take it and we concentrate it and we wash it. So initially we wash it and we try to put it in a gradient and have the sperm that are moving the best and collect those sperms only. And we concentrate in a small catheter, and then in a very small office procedure, sort of like a pap smear, we place the sperm inside the uterine cavity. It's still up to the sperm to be able to go into the fallopian tubes, find the eggs, and fertilize the eggs. So it's as natural as you can make the process be. I always say the purpose is to bring the two players close to each other. It's still up to the sperm and the egg to find each other and create the fertilization.
Right. Wow, I like that analogy. And would you give an advisory to the men in terms of their age, in conjunction to the age range that a woman should be considering testing?
So speaking in very strict definitions, advanced maternal age is considered above age of 35 for the female, and advanced paternal age is considered above age of 45 for males. But
above 40.
Treatment, or when we look at evaluation, it's always determined by the age of the female as a couple.
Wow, that range there. Wonderful. Okay, fellas, great information for you all as well. Well, Dr. Akopians, would you talk to us a little bit? And this is actually, I want to say an underdeveloped, but not an aspect that's not communicated as much as we are familiar with IUI and IVF. But would you talk to us a little bit about assisted reproductive technology?
Sure. Technology is essentially anything that involves the laboratory in helping create a baby. So intrauterine insemination is a form of assisted reproductive technology, because we obtain the sperm, we process it in the laboratory, and then we place it back into the female uterus. And obviously IVF, which is a little bit more involved in this aspect of things, is also assisted reproductive technology. So I would look at it as an umbrella term, the umbrella being assisted reproductive technology, and then within that umbrella term, we have intrauterine insemination or IVF.
Got it. That is assisted reproductive technology, everybody. How often is the assisted reproductive technology successful?
Depending on the treatment option was medicated intrauterine insemination. Generally, the success per month is somewhere between 8 to 10%, and it's really determined by the age of the female. So probably less than 8% if somebody is in their late 30s to 40s, and a little bit closer to 10 to 12% in somebody who's just not ovulating and is younger.
Wonderful. Questions are coming in. Got it. This is wonderful. Before we go to our Q&A, Dr. Akopians, is there anything in addition that you want to add or contribute to the questions that you have so eloquently answered and really given a diversity of understanding to them?
I would not delay getting sort of evaluated. If you're above age of 35 and you tried even within 3 months and you haven't been able to achieve a pregnancy, it's probably worth at least doing the evaluation so we can catch something early and be able to offer help. For the young females who are trying to defer childbearing because of either education or career goals, at least get an evaluation and see where your ovarian reserve is now. And you don't have to take the step if you don't want to and you're not ready, but it gives you the option. And I always say power, knowledge is power. At least having the knowledge where your ovarian is, and then making the decision with your physician in regards to what the next steps would be. In terms of IVF, I would say doing the research and really looking at what laboratory and what success rates are basically at each laboratory in its center, and really trying to make the most educated guess so you're in the best hands.
Wow. And, you know, in conversation with ladies this week, one of the things that I was stressing for those who have religious beliefs or any other belief or practice of any kind, that the one thing you want to have is knowledge in your corner. And you just emphasize that to be proactive. Can't stress this enough, you all, to be proactive. I don't want you to violate any of your beliefs or your belief system of any kind. But if motherhood is a tiny possibility in your future, you want to empower yourself by looking into the options, being tested, and see the health and the reserve, that the health of your eggs and the reserve that you have available. If you don't do anything else, you want to know what's going on in your body. And I think back on, generations past, even within my former generations, that this was an area that you just really didn't talk about. My grandmother was fully pregnant and still did not have an awareness of where children came from. So, times have changed immensely. And so because we have the information available, I want to just implore you to empower yourself. Know where you are as it relates to your fertility health. Well, the questions are coming in, and I have a question. This is anonymous, so I'm not going to share information as to who's submitting the questions. But we do have a question from one of our gentlemen who's asking about sperm life in terms of freezing and testing.
In terms of freezing, so in terms of analysis, there are 4 aspects that are looked at with the sperm, right? One is how much volume of semen has been produced. The next thing is in every ml of volume of semen, how many sperm are seen. That's called the concentration, and usually it's in millions per ml. And then the next thing is what percentages of the sperm are moving. We like that to be above 50% generally, somewhere between 40 and 50%. And then finally, they process about 150 or 200 sperm, where they start measuring different parts of the sperm, such as how big is the head, what's the diameter, what's the length of the tail, what's the diameter. That's called the morphology, which is called the shape of the sperm. And we like that by the most strict criteria, which is called the Kruger's criteria, to be above 14% normal in shape.
Wow. We touched on that a little bit last night as it relates to male infertility, the shape and the movement of the sperm. Is that a big aspect of determining fertility life in a man, the shape and the movement of the sperm?
Shape, movement, as well as sperm there is, the concentration.
Wow. Got it. Okay, I hope that answered your question. I'm sure it did. Our next question is, what is the full time frame for IVF?
Full time frame for IVF to create the embryos is generally about 3 to 4 weeks. We get the eggs out, and then they spend about a week within the laboratory. We always, in our facility, like to split the IVF cycle between where we create the embryos and then when we transfer the embryos back in, because we found that success rates are better. So what we do is initially do the IVF part, get the eggs out of the female body, create the embryos in the laboratory, freeze the embryos, let the female body recover over a 10-day period or so. And then for the next cycle, we do what's called a frozen embryo transfer, where we prepare the uterus lining and we thaw the embryos and place it back inside the uterus cavity.
Wow. And Would you say that, kind of going back to the first question, would you say that there is a preference for the man to submit his sperm? And I know there's a sensitive time factor in terms of whether he is in the center, in the clinic, and he goes through submitting his sperm, or whether or not he can actually bring his sperm into the center.
So yes, sometimes our male partners select that home, and that definitely is an option. We usually tell the patients to transport it to our center within 30 minutes.
Within 30 minutes. So it's really best that you just wait until you arrive on site, guys, especially if you know anything about traffic.
You could push that to an hour, but anything beyond an hour, it may negatively affect the sperm quality. So we try to be the safest and say 30 minutes.
Wow. Well, I have a woman who is single. She does not have a potential partner. She says she's not aware. She doesn't know when that's going to happen. She does want to be a mother. She doesn't have any factors necessarily holding her back from proceeding. What would you recommend she do?
How old is she?
Let me ask her really quickly. She's 33.
I would say definitely reproductive endocrinology and infertility physician to get your ovarian reserve tested. And based on that, in your discussion with your doctor, you can come up with possibilities of what you'd like to do. One would be to freeze your eggs for future use, if that's something you feel comfortable doing.
Wonderful. And Dr. Akopians, what questions should I ask a reproductive center when considering them?
So you would want to know their success rates. Every reproductive technology laboratory has their own unique success rates, and that's one of the things you would want to look and see, making sure that the facility is available and open and most days of the week. So if your cycle falls on a weekend, you'll have that flexibility to be able to go in and be able to get monitored. Making sure the physician is somebody you feel comfortable with, because you'll be working closely with that physician over the period of 3 to 4 weeks. And in details of the IVF success rates, in terms of what is their rate of having embryo development at different ages, what is their success rate, and
that's good. That's really good. It definitely matters when endeavoring in this expensive. It can be expensive, it can be emotional, and it can be physically taxing. So if you commit to partnering with a reproductive center, you want to make sure that they are a center, as she said, that has a very high success rate. Just like the SCRC, but I'm not trying to persuade you guys. Do your homework. This has been great. This is so wonderful. Thank you so much, Dr. Akopians. You have given us a copious amount of information. I hope you all that this is provoking thought, as well as encouraging you in knowing what direction you need to consider in moving forward. There's flexibility in terms of options, whether you are single, whether you're in a committed relationship, whether you are married, or whatever your status may be. It doesn't have to be a restricting factor in your life. I do want to share with you how you can continue to follow and stay abreast to all that Dr. Akopians is doing. You can follow her on Instagram. And I will type this in as well, you all. Her Instagram page it's very simple, Dr. Lina Akopians. And she's also connected. Let's see. Let me put this on really quickly. There we are. And then also the Southern California Reproductive Center. You can follow them actually, their website, which is scrcivf.com. I'm going to place this online for you as well. They have some wonderful videos for you to watch as well. If you're really curious on just the inside scoop of how this center functions and how they operate, and you're interested in meeting the physicians online, you can simply go onto the website and you can find the information there. It's really a wonderful, loving place to experience. Again, I'm not trying to persuade you. I'm just saying. And then also,
and let you know through the website also, we have the ART website, which is our in our laboratory. Basically, there are 19 videos showing the entire process of IVF and egg freezing. So if you're curious,
wow,
goes through every single step, and those 19 videos are available for you to review if you'd like to just gain more knowledge about it.
Thank you. Please take advantage of that resource. Going online to the website and take a look, browse and tour the video so that you can see exactly what the process looks like, which I think we all at some point have a curiosity of, okay, what does this look like? And then, of course, you can follow me online at lashannaleonard.com. All of my social media outlets are my name. It's very easy. You can simply find me at LaShanna Leonard. I have to say thank you to Shaq Ray, Mr. Shaq Ray, Tracy Reynolds for making this happen, for connecting us together for today's wrap up. It has been such a personal and professional pleasure for me. And I want to say thank you once again, Dr. Akopians, for being available today. Everyone, I do want you to go onto my website, though. Go to the blog. I'm going to have a wonderful wrap up of the virtual summit that will include the information that was shared this week. While you're there, you can also join and become a She Warrior, which is just a community of women who are braving womanhood and reclaiming their womanhood. It's a support system where you're able to share stories and also have someone alongside of you while you go through this, so you don't feel so isolated and so alone. And I send out wonderful loads of wonderful information and tips throughout the week via newsletter to keep you successfully navigating through your journey. So I definitely want you to do that. And if you are in the Houston, Texas area, LaShanna Speaks. On Saturday, I will be at the Crossroads Church for their Wellness Day, 10 o'clock a.m. in Pearland, Texas. Do join me. I'm going to be sharing on the 5 states of wellness that can make or break a healthy lifestyle. All right, we are wrapping up here. Are there any final words that you would like to share with us, Dr. Akopians, before we sign off?
I will actually let you also talk at the Pasadena Center this Saturday at 11:30. So if there's anybody within the California area and in Southern California that would like to come and listen to me discuss basics of the fertility, it's called Fertility 101, really going through the steps a little bit more in depth and educating our audience, feel free to come by.
Come by. Please do, you all. Please do. I know we have quite a few people that are tuned in from Los Angeles, Glendale, my area, the Bay, which is Gardena. That's where I reside in California. Do go by if you have time on Saturday. And also, and let me also say, as we sign off, that the center is always hosting clinics and workshops on a regular basis that help to bring you in and give you one-on-one, on-site and off-site, just as Dr. Akopians is doing on Saturday. Wonderful clinics and workshops to really get you abreast to the fundamentals of Fertility 101. So as we sign off, I'd like to say thank you to each and every one of you. You know where to find me. You know where to find Dr. Akopians. And as I always say, health, wealth, and the abundant life belong to you. Thank you so very much. Thank you, Dr. Akopians.
Thank you, LaShanna. Thank you.
Bye-bye.
Bye-bye.
Bye.